Okay, today we're going to talk to a patient of mine who has had type 1 diabetes for over 40 years. He's in his 60s now, and the reason for this tape is to give everybody a realization that people with type 1 are different once they get older, and specific things have to be considered. So I'd like to introduce the patient, Mr. Jim.
Hello.
Tell us, Jim, I understand you had type 1 diabetes since you're about 18 years old.
18, graduated high school, and it hit,
How did it start? What kind of symptoms were you having?
symptoms, thirst, tiredness, change in eyesight. I didn't need glasses. My eyes could read signs from clear as could be without glasses.
You were kind of tired, you told me.
Oh yeah, wiped out, exhausted.
Did you have any weight change
No.
at that time?
No. Weight was always the same.
Okay. And of course you got help from your doctor, and he got you started on the right treatment.
Right.
What did he start you out with?
What was it back then? MPH, U30 insulin at the time.
That was back.
That's when they had the glass syringes, and then they had Oronase, one Oronase tablet a day, which I didn't take. They sat at the table. I just went with that. I didn't take Oronase.
Of course, that we realize now that was probably not in your best interest.
Yeah.
Now, over the years, from 18, and you told me the other day that you went on disability when you were 29 years old.
1974.
But you had been working as a mechanic for cars and a delivery man.
Delivery, yeah.
What kind of problems were you having in your early 20s?
Let me see. I was in early 20s. Well, like I said, early 20s. I was still pretty good. It was later on. Probably about 26 to 29. I had ulcers on my feet and blood every time I went and moved something. I tore my feet up with ulcers and ended up in the hospital with blood poisoning.
Now, about with working on the cars
Right.
with your hands, how about troubles you were having
I
there?
used to cut myself or burn myself and wouldn't know it.
Yeah.
I grab an oil filter or something and unscrew it, and it was hot, and I have the whole palm blistered.
So you were losing feeling in your feet and your
Yeah,
hands,
yeah.
and so that made it difficult for you to do your work.
Right.
Of course, despite that, you got married, had a son, he grew up, in later years had a divorce.
Right.
So you're living alone at this time
Right.
in your own home.
Sure.
Okay. Over those years, did you ever have a condition we call ketoacidosis? Have you ever had that?
Yeah, a couple times.
How did that come on?
Well, I had the flu at one time, and I wasn't eating or drinking. I had maybe a tea or ginger ale or whatever. So I wasn't eating. I wouldn't check my sugar. And after 3-4 days, it was just, didn't realize I was in ketoacidosis. I never checked anything.
Did you have...
They didn't have the tests in that like they do now.
Okay. Did they put you in the hospital at that time?
I'm trying to think. Yeah, one time I was in the hospital.
Okay. You treated it and you got over it.
Sure.
Okay. You mentioned the machine you talk about here. In other words, when you were 18 until...
No, they didn't have it.
They didn't have that machine for some years, wasn't it?
Oh, that was in the 70s, I think. Late 70s, 80s.
And then you had, I think you were one of the first,
Yeah,
I remember.
they were primitive. You had to plug them in and let them
warm up for
they were
minutes.
dinosaurs.
Okay. So you really, even though you had a machine back 20, 30 years ago, you really weren't able to use it effectively.
Well, it was so much time to set it up and everything.
Yeah. I think that machine you donated to the diabetes office here is in the museum. Yeah, it's a museum piece. So we've come a long way with insulin, not only insulin, but sugar checking since that time.
Right.
And I think as a person, a number of years, you can tell me if I'm not correct, in your 20s you're invincible, you're not watching things like you probably would if you were 50 or 60, I think. So.
Well, back then if I got my blood sugar at 70 or something, I get weak and start perspiring and stuff. But now I've had it so long, I have no warnings.
No warnings. Okay.
Except for my eyes. I'll see spots or something and feel like I have pressure in my cheeks, and I know it's.
Then you would know. But the old days, you would get some more warning. In other words.
Right. Yeah.
Okay. So that brings us to the second part of our talk on the insulin that he's used. He started off with the animal pork and beef insulins from years back, I don't even think they were U100s, if I'm not mistaken. That's pretty historical.
They were U30s.
Mm-hmm. And at this point, he checks his sugar, and he has for a number of years, not just once a day, but tell us how many times?
5 times.
5 times a day. And you have a nice machine to do that.
Yeah.
What kind of insulin do you take now, and how do you monitor your insulin?
Humulin 70/30,
Uh-huh.
and then I check it in the morning, and I eat. And the second time I check it's in the evening.
Mm-hmm.
No, afternoon, about 2:30, then the evening,
Yeah.
before I go out, when I come home, and in between,
Okay. So you're checking it, and you have a schedule that's regular for you.
Right.
But might be irregular for other people. But for you, it's pretty consistent every day.
Yeah.
Is what I understand. Tell us, when you give the insulin, I know over the years you may have changed your technique. How do you give that, in special areas like they talk about?
I used to be in my legs,
Uh-huh.
and now it was inconvenient if I went out for dinner or something. Now I just under my shirt.
Mm-hmm. Do you ever rotate, or just basically?
Well, I go from one side to the other.
That's it. Never your legs anymore?
No, I tried, but it absorbs differently.
Oh, okay.
It seems to get into my system fast, and then it burns out. I get more. It lasts longer in my stomach. It works over a longer period of time.
So that's the preferred for you. Have you had any side effects at the injection site and changes in your?
Oh yeah, I got.
Do we see that?
Yeah, I got
He's had.
flaps here where I've been taking it.
Okay,
Yeah.
so you have some fat changes
Yeah,
there.
right there. Everywhere else.
Everywhere else
is
is okay.
Yeah.
Uh-huh. Okay. I think they call that, the correct term, lipohypertrophy.
Okay. I used to have it in my legs here, but then I went to my stomach. It's so much more convenient.
When you had it in your legs, did you get the same thing there?
Yeah,
But did that over the years or time
Oh,
dissolve? Or
that went away.
That went away with time. Okay. Okay. Now, you do use a lot of needles, it would seem, with that much insulin, and so often, huh?
Oh, no, I change needles maybe. And if I drop it or the labeling comes off the side, I can't read them anymore.
So you would use your needles over more than once?
Over. I'll use a needle for over a month, the same needle.
Is that right?
Sometimes 2, 3 injections a day.
2 or 3 injections a day.
Yeah.
Do you worry about any problems from that?
No.
Okay. Do the needles get kind of dull, or?
I can't tell. I got neuropathy.
Okay.
I put an ice pick, I won't feel it.
Okay. And how about?
If I bend one, I'll throw it away.
Okay. So you save yourself some money that way,
yeah.
for sure. And I think if you look at the literature last few years, and that's become actually, I don't recall the journal, possibly JAMA. They've talked about this multiple use of the needles, and I think when I talked to Jim a few years ago about it, and I was kind of surprised, but not so shocked after all.
I don't swab the bottles with alcohol wipes or anything.
So you're not even
injection site. It just.
You never had infections in your skin?
I'm the only one that uses. I'm not worried about it.
So that works okay for you.
Well, it's been working like for years.
So I would think with type 1 diabetes, you would have to have a pretty regular diet and watch alcoholic beverages and things like that.
I go have my beer every day.
You do? Okay.
Twice a day.
Twice a day.
Yeah.
And has your endocrinologist commented on that at all? Or
Well,
was concerned about
he told whatever I'm doing, he doesn't want to know, but whatever I'm doing, keep it up, so I try.
Okay. So I would think if you changed a lot of things, particularly that, maybe your sugar might plummet.
Oh, yeah.
Uh-huh.
Well, sometimes it goes up. If I don't have my beer at night, sometimes it's sky high in the morning.
Will. And I don't know why that is, but again, I'm not an endocrinologist, but I'll go by your doctor, your specialist's advice, and keep things consistent. What about, you mentioned food intake, you eat regular balanced diet, but are you a good cook, or how does that work?
Well, no, it's usually, I have a brother who sends something, I just heat it, put it in my griddle, set it about 180, put a lid on it. It's ready to eat when I come home.
Okay, were there any hazards when you were?
Oh, I was even making hard-boiled eggs or something. I get everything and cool, and by the time I come in, I go light up a cigarette, which I've been smoking for how many years too. And I'll see blisters on my knuckles from.
Oh boy!
You got the pot holders, but I hit the pot and don't know it.
Yeah. So you have to watch. This might be hazardous for you actually to cook. Okay, with your neuropathy.
I got to be very careful. Yeah.
Has your doctor spoke to you about the smoking at all?
Doesn't do any good.
Okay.
If I quit smoking, I'd eat more instead of throw me out of whack.
So he's tried to stop, I can assure
Yeah.
you, but he knows it's bad for his health, but it's just one of the more difficult aspects in his life right now to get him to stop. So, and we continue to try. So, we'll go on. I have other questions for you. We're kind of intrigued what we've heard so far. With the, we hear about diabetes and exercise, and we hear about, I know with your neuropathy that limits you quite a bit.
Oh, yeah.
And so let's say you would do something more above and beyond what you would do in a day's time,
Right.
perhaps mow the grass or
Yeah.
go out and move boxes. Would you take any?
I don't do much moving anymore
Okay.
because my balance is no good.
Mhm.
I'll go over with it.
Have you noticed that affect your sugar in any way when you would do things physical?
Yeah, yeah, sure. I mean, mow grass or something, about an hour on the mower, I'll just grab a Coca-Cola and drink it down.
Mm-hmm.
It's not much work driving a tractor, but must be the concentration that burns it up.
Okay. Okay. So
Tree
you
limbs.
actually have the Coca-Cola ready? That's
Yeah,
what-
yeah.
Okay.
Yeah, I take a break, go have a Coke.
Okay. And that brings us to the other complication a lot of people with diabetes suffer is low blood sugar. And I wondered if you had any of the, you mentioned earlier that you had, and your symptoms
yeah.
are a bit different. And to repeat, your symptoms when you get low sugar, do you sweat excessively?
Not unless I get down around 17 or 15.
Uh-huh. And then
So-
you're still
but
aware
usually-
of that?
Yeah,
Uh-huh.
well, I usually wake up in the middle of the night with the sweat, and I know I'll grab a Coke.
And
But then if I get a little bit low, I'll see, when I'm looking, I'll see spots in front of my eyes.
Uh-huh.
Sort of like around, I can see around the edges, but right in front of my eyes, there's like spots that
then you know
I gotta,
it's,
yeah, sort of,
and you know it's how low at that point when you see spots.
it's probably in the 30s,
Uh-huh.
20s.
And of course, how do you walk when you feel that way?
Well, I stagger, it's like I'm drunk, and I'm
Uh-huh.
not,
Yeah. And how about your mental alertness and awareness?
yeah, that's pretty good at that point.
Mm-hmm. Okay, now we mentioned earlier with these spells of low sugar that sometimes they get considerably severe. You treat them right away, of course,
Yeah.
with Coca-Cola.
Coca-Cola, yeah. Don't eat, if I eat something that takes too long to eat it,
Mhm.
if I drink a cola, that's better than orange juice to me.
Of course, you live alone. Is there any
Right.
concern there? Do you have people check on you?
Oh,
or-
yeah, come home, I phone in that I'm there, or they
Uh-huh.
call and make sure I'm okay.
And
If I
that's-
miss a call, they call back to see if I'm still all right.
Okay, so that's worked out fairly
Oh,
good
yeah.
for you. And you haven't been to the hospital with low sugar lately or anything?
No, it's been years.
Mhm. By the way, you have been in the hospital, I believe it was a few years ago, I stopped in to see you had a gallbladder operation,
Yeah.
and there was some concern at the time, I think
Well,
your
that
sugar might have gone down.
No, that was before that.
Was it
I
before
was
that?
back when my leg was, when I had the
Uh-huh.
infection up my leg and with the ulcers, yeah.
Your main concern going in a hospital, the way you control your sugar is that, when they get you in a hospital, you don't have access to,
No, nothing, no. I know the one time I had low sugar and I kept phoning and asking them to send me a Coca-Cola. And I ring again, they didn't have Coca-Cola. I said, send me a ginger ale. Send me anything, Squirt, 7-Up, it didn't matter. And finally the dinner tray came and I ate dinner and then they come rushing in. Are you okay? Are you okay? I said, well, dinner finally arrived. I've been calling for 40 minutes trying to get something, but they just didn't want to give it to me.
So finally you got something. So
Well, I got finally a meal, and I just laid back and relaxed, and then I was okay. But when they come back, they must have took my test,
Yeah.
When they came back, it was probably real low,
Oh, boy,
but I couldn't get anybody to give me anything.
right. Well, I think if you went in again, I think you'd probably take a different precaution, have some
So I
of it
take some glucose pills.
Sure, sure.
Or I bring a couple Cokes with me.
They talk about, with when you had the family at home with you, this glucagon. Did you ever have that
Never
kit
had
at home?
Yeah, I have it. It's still there.
Yeah,
I never
but
had
you
it.
never, your family didn't
No,
have
I
to
never
use it
got
or
into it.
anything.
Yeah, see, when I was married and with family, I never ate on schedule. I eat everything between 5 and 5:30. I'm eating supper.
So right now, despite you're alone, you have a more regular
Oh,
schedule
yeah,
of food
yeah.
intake and whatnot.
Yeah, I know when I'm eating, when at a
Okay.
certain time of day, that's when I eat breakfast, when I have lunch.
Okay.
Everything's around the clock.
All right.
Before I go out at night, I check, make sure I'm all right. Sometimes I leave out, eat a couple cookies if I'm around 90, and I'll bring it up, and go out and have my beer and come home, everything's good.
Okay. We're going to finally talk about complications of diabetes.
I have no
We have-
muscle here anymore, that's good.
We
I
have
used to have a big,
lost muscle. Okay.
yes,
We're-
my hair.
we have Jim to give us some more advice here and tell us about how he's done over the years. We, of course, know about his disability and his neuropathy, particularly his legs and his feet and his hands. But right now, we were going to talk from the top and go down.
Yeah.
How have your eyes been doing with this?
Good. Yeah.
You had any problems at all?
No, I had cataracts. This one here was about 5 years ago.
Uh-huh.
And this one I had 3 years ago.
But you do...
I have an appointment today. It's cloudy. I got the 2:30 this afternoon. I got to go to eye care.
Okay.
And check that.
And as far as your eye doctor, he's told you that the back of your eye, the
Yeah,
retina,
very little damage.
very little retinopathy. If I remember right, though, too, for years there was an article about aspirin. You've been on
Well,
aspirin.
I've been since, what, 68, 69, I've been
So-
taking aspirin.
He's been on an aspirin probably 30-plus years,
Oh, yeah, close to
Yeah.
40.
close to 40 years. Whether that has anything to do, I just wanted to insert that because he's been on aspirin for a long time.
Yeah, 3 more years would be 40 years.
So we're blessed with the fact that he's had cataracts that have been successfully removed and just some retinopathy is minimal at best. Tell us about your heart rate.
Heart rate, I was sitting at rest probably about 105.
105.
And it's always right at the 100 mark.
Always a bit fast.
Yeah.
Yeah. And as far as I can understand this, neuropathy can manifest in the heart as a sinus tachycardia. And I think as this has been looked at, this is what it is. How about your bladder function?
Bladder, it was good.
Everything's good?
Yeah.
You don't have to go often, or
Oh, no.
could you go a longer
I
period?
can go, sure. Yeah,
From what
I
I
can
rem-
hold it quite a while.
You've told me that you could hold it half a day sometimes.
Oh, yeah.
And I think that's probably an early manifestation of some neuropathy there, because a neuropathy in a diabetic, their bladders, I always call them 10-gallon bladders. And as long as they empty, we're okay, and certainly empty is okay for him. His blood pressure has been a problem. It's not a major problem, but he was on, years ago there was a procedure done when microalbumin was studied. He had the earliest trace of microalbumin, and he was on an ACE inhibitor. He's been maintained on Acupro. You take that once or twice a day?
Yeah, once a day.
Once a day. And you have your pressure checked regularly.
Yeah, I go to the doctor, yeah.
Uh-huh.
Stop it,
And he's aware of the new studies showing that we would like to get it 130 to below 85, 130 over 85 or below, and that's been adjusted recently. I remember one time, maybe a year or two ago, he was, maybe because of the heat or what he was doing, he did manifest some orthostatic hypotension. He stood up and his pressure dropped between 10 and 20 points. But recently we're not seeing that.
No,
We're not. Is that right? Yeah.
I stay out of the heat. I can't take the heat.
Yeah, the heat's pretty harsh.
Well, my clothes are so thin, I don't feel them breathe.
Okay.
I'm white, I can't take heat.
And as far as the heart goes, despite the smoking, a few years ago he had a stress test, and he was surprised when I told him and reviewed this with him, but he had the right coronary artery was blocked. He had a small area of damage in the inferior wall, and I asked him, did you ever remember having a heart attack? He never did, and of course a lot of persons with diabetes and people elderly have what we call silent heart attacks. But he's not had any symptoms whatsoever, heart failure. His ejection fraction's good. And actually his collateral flow around that area is very good. So it was not even deemed necessary to do a cardiac cath by the cardiologist that was consulted. Although we still, for that reason, would like him to quit smoking. But I'm not going to preach to him on his tape here today. The other feature the last decade we've been aware of is lipid disorders and how aggressively we treat him, and he's been on a lipid-lowering agent. Zocor and Lipitor differently now, Lipitor. How's that been doing?
No, it's good. Let's see, last month I had it was 145, and 3 months before that it was 125, my cholesterol.
Yeah, so and the LDL is much lower.
Yeah.
And he's in goal on his cholesterol and his LDLs and his triglycerides. haven't been as big a problem as a type 2 diabetic would have. In fact, they've been pretty good. The kidney situation, his creatinine's always been good. Like I said, I think it's at least 10 years ago, we did a microalbumin as an earliest stage. Just this week, he had a proteinuria check, and he's showing no macroproteinuria at all, no albumin. And you would expect that because there's always been the correlation of the background retinopathy and glomerulopathy. So if you have no retinal change, you shouldn't have too much glomerular change. And we haven't had a microalbumin level lately, but with the ACE inhibitor and the pressure control, we've been doing very well there. Tell us about, again, now, a lot of his problems are the peripheral neuropathy. How did this dealing with your hands and your feet start? I mean, how did you notice it? Was there a numbness there or burning or?
Well, yeah, I used to have different heat and then itching. I used to scratch and scratch. There was no itch there. And then, like I said, I'd have a blister, it turned into a callus, and then turned into ulcers. I had them on both feet, and socks were always full of blood and pus. And then I had shoes made, I think it was 76, and since then I've been okay. So
he's had special form-fit shoes here for his diabetic neuropathy, and he has some short-coat joints, which we'll show you in a second. And if you look at his hands, we've had some problems. Not maybe his palms so much, but you can see the wasting between the metacarpal bones, so that's a manifestation of diabetic neuropathy. He has a wasting of the interosseous muscles, which probably limits the strength of his hands too, and some here too. And are your hands pretty numb right now?
Oh, yeah.
Can you feel me shake your hand at all?
Oh, yeah, I can feel it.
But it's not the same as it used to be.
Well, I'm trying to pick up change or anything. I can't tell. I got to see what change is there.
And you can't tell the dexterity's missing. And the guy is a mechanic and has good hands. That's a real disability. And the feet are probably more numb.
Oh, yeah.
Basically dead. I could probably take a saw and slice through them.
You cut my toes off with a bolt cutter.
Tell us about some of the problem you had in the bones down there.
Bones, broke them, whatever they call it that one time. The toes were black and blue and swelled up, and I went to the doctor and recently fractured 3 metacarpal, and so that explains the black and blue and the swelling.
Right.
And I had that navicular bone, it shattered, and I walked in here, I drove up, walked in, supposed to get an x-ray that morning. What hell? I said, I don't know. And I said, well, maybe I should have a wheelchair. I shouldn't be walking on it, but I never felt the difference. I just walked. Couldn't get my shoe on. It was just on there loose, but I walked in.
So he had fractures, pathologic fractures at that. He didn't know what he did in particular. Maybe noticed the black and blue mark and a swelling there, and came in and showed some fractures, which were treated. None recently, thank God. Have you had what a lot of people have, the pain in those in the legs that people describe, phantom pains?
Yeah, I had that earlier this week.
You did?
Yeah.
Even though it's numb now, you can still get that?
Sunday I had them in the toes, just the shooting pain, and the next day it was in my, behind the heel, right up in here. It felt like there was an ice pick stuck in here, and then it go away, and then shoot up again. Then they faded away yesterday.
Okay. And you're not necessarily, it's not necessary if you take medicine for that at this time?
No. Okay. You know, at one time I had them so bad, I had that stun gun, and I was running it up and down my leg. It didn't do anything. I didn't feel the stun gun, but I still felt that phantom pain was in there.
Over the years, I think when it was more consistent, I think maybe they had you on a few drugs, but you had like Elavil or amitriptyline or Neurontin.
I had one time when I used to get them at, what was it, Emperor 3s.
Okay.
Nothing seemed to work.
But in your case, though, it's not been something a day-to-day misery.
No.
It just comes and maybe goes away for months. Is that what I understand?
4 or 5 months, and then, like the last time, it moved from my toes to behind my ankle and the tendon. It felt like, and then it goes.
So you're blessed in that way. The neuropathy's reached the point where the pains are gone. Could we take your shoes off?
Yeah.
I know you mentioned earlier in the tape you've had a lot of wasting of the gastroc muscle, the calves.
Oh, yeah, there's nothing there. That's flexed. That's nothing.
So he's had some muscle wasting in the lower extremities. But as he's doing that, I don't know if it shows on the video, but if you look at the shin, he has a few little darkened areas, and we call that a diabetic dermopathy.
And he doesn't, you see that a lot more in other patients, but they have a brown darkening in some areas from little areas of trauma and hemosiderin deposition. So he's got...
Yeah, I got a scab there from banging something, I don't know where.
And then he's got the socks, a good, appropriate socks on. Now, a lot of people with neuropathy, they have so much paresthesia they can't even wear socks.
Probably on my callus.
There you go.
I still have a callus down there.
And he's got some callosis here over, and actually looking at his arch, he's blessed he has a wonderful arch. A lot of people with neuropathy just collapse the arch and they end up with a rocker bottom foot.
It's probably because of the shoes, though.
And I think the shoes have remolded his architecture. He has a callus and he watches over those, but geez, that's not bad considering that there's no, can you feel me at all down
No.
here, Jim? Okay, let's take a look at this one here. And when you say no feeling here, would it be from here down or just
Yeah,
gets
it's like
more
I
and
said,
more?
I banged myself last week and I don't know where.
Okay.
Yeah.
And then if you look at this arch, you can see a little difference. This arch is a little less developed. He's had a little bit of change there.
Well, this is the one where I shattered in the navicular.
And that's, he had a pathologic fracture, so it changed the architecture there with the Charcot joints. And he's got pulses, so he's got, really doesn't have much macrovascular disease. And if you look at his nails, he's got a bit of fungus.
Yeah, that was from the one guy that made my shoes.
Uh-huh.
I won't say his name, but he made them too short.
We'll just look at the shoes, and they're specially, tell us, what do they have to do to make a shoe like that for
You
you?
have to take the mold of your feet and they cast it to fit it like a glove. You know?
And so it really is only for your foot and contour.
See if this
It's pretty nice and padded in there.
insole would come out. It's probably dirty.
And he's got, obviously doesn't, you know, with his manual dexterity, he has
But
Velcro
the
straps.
shoe and that, they just fit the foot like
Form fitting,
yeah.
very nice. But they would have to take a plaster mold of your
Yeah.
foot. Okay. And those, I think that's really saved the day for his feet. This shoe has been a godsend. You had those for how long?
Well, not the same pair, but I think it was
No.
76 I got.
He's had, okay. So he's had them changed as they worn out since 1976, and I think that says a lot to the quality of his feet, and he watches it. Do you ever walk barefoot around the house?
No.
Okay. And of course, why wouldn't you do that?
Socks.
Okay.
I wear socks, but oh yeah, it's step on something I won't know it.
That's right. So we always caution people with diabetes.
And if I got socks on, I'll see a red spot if I have something.
There you go.
If I step on a thumbtack,
I'll try
to blood in the sock.
I'll try to do some reflexes here. And I don't get any reflex at the ankle. And I think we checked this a number of years back, and I don't think we get anything at the knee.
Yeah.
And so in a diabetic, you'll lose, with neuropathy, you'll lose ankles and eventually knee reflexes. So he's definitely got that. I'm not going to go to the point of pinprick there,
No, you can't.
but I'll go ahead and do vibration. Can you feel that at all?
No.
You don't even feel the fork, do you?
No.
How about up here?
I feel a little bit there.
Feel a buzz at all?
Very little.
Okay.
Very little.
Feel that buzz?
Just a little bit. But I don't feel it there. I feel it up here.
Okay. Okay. How about that? Do you feel
No.
nothing? Okay. So really, there's a marked difference. He has a little feeling. He actually feels
I
it
don't
up
feel it
here.
here, but I feel it.
So really, up to here is where he actually senses the vibration through the bone.
I feel it here. I
So-
feel it here. Out here, I don't feel anything.
Let's try it up here.
It's just a little bit.
Just a little
Not
bit.
there.
If he doesn't feel it here, he feels it up here, which is the vibration transmitted up to the bone. And how about that?
Yeah, I
Feels it up there higher.
Yeah, a little bit higher. Yeah.
Okay. Okay. Now I'm going to have you close your eyes and tell me if you can tell me if your toe is up or down. Can't even tell I'm down there. Okay. So he's definitely, that was an early loss of position sense. Okay. Information to help us understand type 1 diabetes, particularly now that you're getting older,
Yeah.
which we have not seen in the past. People with type 1 don't make it into their 60s often. For the final part of the tape, could you walk about 10 or 15 feet?
Sure.
Now, for the amount of neuropathy that Jim suffers, turn around. Down the street, I don't think most people would notice that he has a little, just subtle, just subtle.
Yeah.
And for a lot of people with this kind of neuropathy, particularly elderly,
they'd have to have a wheeled walker along the way, otherwise they'd fall off, even on, you know, territory in their home. So that's quite impressive. So you're an impressive man. We appreciate the time. Thank you.
No, you're welcome.